I'm Dr. Natalie Marks. I'm a small animal veterinarian, and I'm here today to talk to you about ways that you can help protect your dog from respiratory disease this season. Yes, respiratory disease season is upon us and really ramping up for your dogs. It starts to peak between Memorial Day and Labor Day and spikes in July. And so for the dog owners that are listening right now and watching, this is certainly very different from humans because for us, we think about respiratory disease really ramping up in the fall and winter. That's why it's perfect time right now to talk to your veterinarian about your dog's risk and vaccination options so we can keep them as safe and protected this season. There's diseases out there like canine influenza, canine parainfluenza, and Bordetella bronchiseptica that are easily spread through things like direct dog-to-dog contact, contaminated surfaces like toys and leashes and water bowls, and through secretions from dogs coughing and sneezing. And we see these diseases easily spread at places like daycares and kennels, but even outside our neighborhood walks. So if you're out there planning your spring break or summer travel and contemplating boarding your dog, or you're just getting outside more as the weather's getting nicer, really important to talk to your veterinarian about vaccination options so that we can avoid the spread of disease. As we think about these big three, again, canine influenza or dog flu, canine parainfluenza, and Bordetella bronchiseptica, they're probably the most common illnesses that we see that can be potentially harmful to your dog. The good news is that most of these diseases are mild. So we see cough, runny nose, fever, lethargy, or loss of appetite. But that persistent cough for your dog can be really uncomfortable. And in severe cases, these diseases can progress to pneumonia, which can be life-threatening. So when pet parents ask me, what's the best strategy to keep my dog as free from respiratory disease as possible, it's always prevention through vaccination. And two preventative vaccines from Merck Animal Health that I really love and recommend are the Novivac Intra-Trac oral BBPI and the Novivac Next Canine Flu H3 and 2. And for a couple reasons, I want to go over each of these a little bit more. So the oral BBPI, as you can imagine, has two components to it. BB for Bordetella bronchiseptica and PI for canine parainfluenza. These are the two most causative agents for a syndrome that most dog owners have heard of, which is kennel cough. So I love this vaccine because it's super comfortable. It's administered orally through this immunomister applicator on the end of that syringe. We just gently mist the back of your dog's throat. It's a stress-free experience, can't miss coverage. The other is the Next Canine Flu H3 and 2, and this is a low-volume, preservative-free vaccine that provides optimum protection against the most common canine influenza virus in the U.S., which is H3 and 2, without compromising comfort or safety. So if you want to learn more about these two vaccines or just vaccination options in general, you can visit merckanimalhealth.com. And don't forget, it's also equally important to talk to your veterinarian about your dog's risks and vaccination options so we can keep them as protected as possible this season.